Yeah, I'm so glad. That's interesting. Yes, Abby, hi, I'm still in Boston. I was supposed to come back this weekend, so I'm gonna be here a little bit longer. So that's why I haven't scheduled anything yet. But I'll try to call you. The phone that I'm calling from has some issues, like the sound isn't working, so I might have to call you from a different phone. But hopefully I'll be able to keep you posted to as to when I can pick up shifts at the next bar, okay? Still in Boston, trying to get back to Maryland. Yes, I know what I see. Yeah, it's just. Yeah, I'm just gonna go, honestly. Just going crazy. Just basically what's going on. They're like going crazy. Like, I'm just like, what is going on with you? Anyway, you're not looking right. Um, Okay. Hello. Let me see what the guy. Hello, everyone. This is Nurse Travels LLC, and welcome to our MedSurg review. This is to get the CMSRN credentials or RNBC. My name is Gina DeRozier. I'm your nurse hosting this session. I'm a part of Nurse Travels LLC, and this is also my YouTube channel. So welcome. I'm going to go through this session, but this is going to be a recurring session. I'm trying to see if I can offer it at times when people are more available, like at a nighttime. But because I'm a night shift person, this is why I was able to present it to you guys at this time. All right, so we're gonna start. So basically the format that I'm going to use is I'm just gonna go through the questions. I'm gonna go through the questions and then I'm just gonna go through the questions and I want to give you time to look at the rationales. So we're just gonna go, there's 150 questions. So we're gonna go through them like very rapidly to not waste any time. And then I might make a comment on, I might read out the rationales, I might not, but I just want you to get an idea of what type of questions are on the exam. Okay. At this time, so we're already sharing. I am using the Mometrics practice test. That's what we're using. It is a free practice test. Okay. So at this time, we're gonna go into the actual test. So the is mometrics.com academy/MedSurg practice test. For today, we're just gonna follow with me. And then after this session, you can try to go at it or, try to practice on your own. All right. So we're going to get started. So this is the first question. All right. All right. So this is the first question. If you want to join me by Zoom, go ahead and join me by Zoom. Okay. So you can ask more questions that way. All right, so we're gonna go with the first question. All right, I guess you guys can see it. When using Maslow hierarchy of human needs to develop a patient's plan of care, which of the following needs is the most difficult to assess? Okay, that's question number one. Okay. All right, I don't know if you guys see all those choices. There's about 4 choices: safety, security, physiological needs, self-esteem, and self-respect. Okay. And the correct answer for this one is self-actualization. Okay. So at this time, I'm trying to see if you guys can see the rationale. Can you guys see? I can't see the rationale. Okay. So when using Maslow hierarchy, so this is the rationale in the box right here. When using Maslow hierarchy of human needs to develop a patient's plan of care, the need that is the most difficult to assess is the self-actualization, because this is very subjective. And the rationale will tell you why the other answers are not correct. Okay. All right. I'm going to go to the next question. A patient has a complete colectomy. The nurse action is the most important for the patient is to, okay. All right. I might have to go down to 100 so you guys can see. Okay. A patient is a complete colectomy with an ileostomy. The nursing action is the most important for the patient is to monitor the electrolyte imbalance. I'm going to try to use the larger print, but I'm not exactly sure if that's gonna work. Okay. All right. So you guys understand why you need to monitor the patient for fluid and electrolyte imbalance? Okay. Going to the next question. A patient is scheduled to receive hemodialysis at 10 a.m. and has several medication ordered at 9 a.m. The most appropriate action is to. So I want you to see why they picked that answer. All right. All right. So in future, for future, I will go through which question to focus on. Like I'm gonna try to do a cheat, like a little cheat review, so you guys can see which areas to focus in on. Okay, but for now, we're just gonna go through this. All right. So we're just gonna go through the next question. Number 4, patient's diagnosis is pre-renal failure. The nurse intervention that is top priority for this patient is to do what? Okay, so look at the answer and read why it's important that they pick that answer and why the other answers are not a good choice. So again, I'm going to move quickly if you want me to stay more on a question so you can read it. So at this time, I will not advise to take notes. It's just because you'll be able to do the practice again at a later time. Maybe you can put down the question number so you can review it more and maybe make a flashcard, but you'll be able to go. So when I do this practice test, there'll be a point, I think they let you do the first 5 questions and then they'll be asking you for your email address. Okay, I'm gonna go question 5. Take some time to read the question and look at the rationale if you have time to write notes on that one. Okay, we're moving along to the next question. A patient been examined by the nurse has mixed Bernese point tenderness and a positive jaw sign. Which of the following is the most likely diagnosis? Okay, so if you have time, you can do a flashcard on this one. The diagnosis of acute appendicitis can sometimes be aided by physical examination findings. McBurney's point is found in the right lower quadrant, 2/3 of the way between the navel and the anterior superior iliac spine. The jar sign is elicited when patients experience pain after they stand on their toes and drop to the soles of their feet. Pain is due to the jarring of the inflamed peritoneum caused by acute appendicitis. Neither of these signs is positive in other test choices. Okay, so question triad. All right.
Recording in progress.
All right, next question. Okay, did you guys get this is a good flashcard question. Okay. All right. So Cushing triad is be good to do a flashcard for this one. I'm gonna move to the next question. Question number 8. A nurse is caring for a patient who received radiographic contrast medium for procedure, and the patient shows signs of dyspnea, flushing, and pruritus. The top intervention is to do what? So if you look at all the other options, that airway is always going to be top priority in any situation. Think about your ABCs, like when we have emergency situations. So the patient shows signs of an allergy to the iodine in the contrast medium. The first action is to ensure the patient's airway is patent. If the airway is compromised, call a cardiac arrest code blue, checking vital signs and calling for the physician and important nursing actions, but should follow ensuring patency of the airway. A cold pack is not indicated. So basically, this person is having an allergic reaction. Okay. Moving along to question number 9. Now, these types of questions, I don't think they're not very common on the test, and I wouldn't spend like hours trying to um, distinguish from these psychosocial models of development. But just be aware, like this is something we've learned in school, and you know, um, it can pop up, but they're not a lot of them. Again, for number 10 is the same situation. They want you to know the stages of Kubler-Ross, 5 stages of grief. Just kind of like have that knowledge on the back of your head, but it's not like there's not going to be too many of them. That's what I mean. So I wouldn't waste time trying to make a note card, a flashcard on something like this. Um, all right. So just be aware of the Kubler-Ross 5 stages. That it could be a test question. Again, there's another one, Orlando nursing process theory. I don't really remember this in school. Um, so there is an Orlando nursing process theory, and in the rationale here, they kind of go through what it is, the 3 elements of the nursing process. So just something to be aware of. Again, it's not going to be like maybe 1 or 2 questions will be on certain questions like this, but I will do a flashcard on that. Again, so here again, another um, administrative type of question. Number 12, if a patient is hospitalized in a skilled nursing facility according to OBRA provision, how frequently must the patient be seen by a physician or nurse practitioner? And here is the answer. So this question might pop up. You might want to just do an educated guess if you don't remember and just try to, think about how some of these nursing facilities operate or based on your memory. But um, in practice, if you when you're taking the exam, if you see a question like this that you cannot remember or you can't even like do an elimination process, just go ahead and guess, do an educated guess, but do not leave any questions blank. Okay, yeah, don't leave any questions blank because you might get it right. Um, but just do an educated guess. So this question number 13 is could pop up on the exam. It is very common, and this is something that we see in clinical practice. So a patient is being discharged from the hospital. During his hospital stay, he was diagnosed with a deep vein thrombus in his right leg, okay, which we call in our clinical setting a clot, right? A clot is formed in his right leg. Which of the following tests should be ordered as an outpatient to monitor the patient's condition? Okay, so this will be a good flashcard question because in the rationale, it breaks down what each type of test is for. So it will serve as a multi-purpose flashcard. So what you can do is make a flashcard for which for X-rays, Dopplers, CT scan, and MRIs. Just probably do different flashcards and then kind of distinguish what each one is for. So they saying here that the ultrasound Dopplers are the gold standard for diagnosing superficial vein thrombosis and deep vein thrombosis. So yeah, so this will be, and to me, I find that this type of question is pretty easy and straightforward. Question 14, a patient being examined by the nurse experiences pain when the nurse palpates her right upper quadrant with deep inspiration. What is the physical examination finding called? Okay, so now here we can distinguish like what I will do in this situation, because this is a study review class. We're just trying to identify studying techniques when you're studying for this exam. So what I will do a flashcard. I will do 4 different flashcards for each of these. I'll do a flashcard for PSOAS sign, McBurney sign, Budinsky sign, and Murphy sign. So say you're an exam and you know for sure what a Murphy sign is, that will help you. So then that will help you to distinguish between the other one. Like you'll be able to eliminate which one you should pick, right? So positive mercy free sign aids in the diagnosis of acute cholecystitis. Okay, and then they go ahead and describe what the other signs are. Okay, so now we know for sure Murphy's sign has to do with acute cholecystitis. And the acute cholecystitis is when you're gonna palpate the right upper quadrant with deep inspiration. Because you might find another question asking you like, what's the location of acute cholecystitis? Okay, so you know it's in the right upper quadrant. Okay, question number 15. Hi, it's Gina. Hello, can you hear me? I can't hear. Can you hear me? Okay. I don't know if you guys hear a little bit of background. Just I'm not All right, I'm gonna just move to the next question and try to deal with the sound situation. All right. So did you guys see number 15? Basically you can do a flashcard in terms of what a diabetic gastroparesis is and how it's treated. I'm gonna move to question 16. This again has to do with Kubler-Ross 5 stage of grief. So this is a second question we find on this Kubler-Ross. It might be worth doing maybe a little flashcard on it. Um, but I don't think there's a lot of questions on it on the exam. So I'm going to move on to question number 17. A patient has been evaluated for potential meningitis. Which of the following is not a typical sign symptom associated with meningitis? I'm going to give you a few minutes if you want to write some notes on this one. Please pay attention more on the rationale. Okay. I'm going to Right. I'm going to put it back to 110 so you guys can see the rationale of what nystagmus is not a common finding in those afflicted with meningitis. So I'll give you a few minutes. Moving to question number 18. If a patient is newly diagnosed with epileptic seizure disorder, at which point shall a steady state trough level of the prescribed drug be determined? So I want you to, when you're looking at the answer, also look at the other choices. Um, so in our next review, which is going to be the same exam, we'll have to take the test again together with and then pick the question answers. I went ahead and picked did all the tests and then going back so you can see the rationale because they're not going to show you the rationale until the end. So I'm just doing this for purpose of time. But the next review, we will have to go through all the tests, all 150 questions, and then go back to look at the rationales and why we entered the way we did. Because it's very important that we go through the process of how we're choosing the right answers. Okay, because what we want to do is look at the question, look at any clues that are in the question and in the answers to make an elimination process. Okay. Keep in mind that this exam is only 3 hours, so I mean, you have to kind of like um, move quickly, but you also want to take your time. So I'm quickly gonna tell you guys my method of how I take this test. It's 3 hours. There's 150 questions. Plus, they give you, I think, 30 minutes to go through a tutorial before you take the test. Okay, we're going to talk about this in another review. But I'm just going to give you guys some tips. Okay, so what you want to do is, of course, you want to get to the place early to your testing center, which is a pediatric center. You get there early. After a good night rest, you're not going to be cramming the night before. You get a good night rest. You eat your lunch or breakfast, whatever time you're going.
bring a snack and everything like that. Get yourself settled in. 3 hours and 30 minutes. So what this means is that you are going to, what I did was take the test, I didn't go through a lot of the tutorial because I took the test at least twice before I passed it. But so what I learned to do is to read through all the questions for the first hour, answer whichever I knew for sure. And then my second hour after a break was to go through the what I thought were difficult questions and took my time with that. And then the last 30 to 45 minutes is do a review. And then that's just the way to, I feel like, worked for me to taking this test. So that way you don't feel like, okay, you're running out of time. But what I want to emphasize is that you want to take your time to read the questions and look for clues in the questions. And this will help, like if you're like someone like me who have test anxiety, this will help you. Okay. The good thing about this test is that they're going to allow you time to, like on the test they give you features where you can highlight and you can strike out certain words on the question, so that way you can help you. And the good thing also about this test is that it allows you to review, go back to a test question that you missed. There's certain tests that you take, they don't allow you to go back, but in this situation you're able to go back to a question if you missed it, and you'll be able to review all your questions and answers. But like I said before, do not I will not answer a question. I will not leave anything blank. I will still make an educated guess. Okay. Okay, next question 19. A non-responsive patient is administered Arcan for a heroin overdose. At what point should the patient be administered a second dose if there's no response? So we go over the question, and I want you to really pay attention to the rationale why they're saying this. So this is the point of this study. So we're focusing on rationale, and just get a, if you need Narcan before, you know, this might be a good time to understand how Narcan works. And that's another reason why they're recommending people to have, like, I mean, as a new grad, of course, you can take the test, but it's always good to have, they want you to have at least 2,000 clinical hours. So that way, when you're taking this test, a lot of the situations from a clinical setting will come to mind. Okay. Um, so hopefully when you're taking the test, your experience will come through and you'll be like, oh yeah, I remember seeing this in a clinical setting. So yeah. So here's number 20. A nurse is caring for a patient who has just begun to seize, right? Which of the following position is most appropriate for this patient to help prevent aspiration? Now, say you're a new graduate, you might have not seen a patient have a seizure, but hopefully the class setting, this will come to mind. Okay. So just know that for seizure patients, you do not want them supine, which means you're on their back, or Trenenberg. You guys know Trenenberg is like when they have them tilted almost upside down, or prone. Prone is on their belly or their stomach, their abdomen. So you want them in lateral, which is side position, okay? And here it explains why you don't want them in other positions, because you do not want them, it's the A word, you do not want them to aspirate. Okay, like you don't want them to choke on their own secretions. So that is why they saying lateral recumbent. Okay, the key word is they don't want them to aspirate. So as long as you get that concept in your mind, it all starts to make sense. Okay, so a lateral recumbent position is for your seizure patients. Okay. Um, Question number 21, dialysis patients again. So for your review, note that they ask a few questions on dialysis patient and on your kidney patient. And now we know for sure they're going to ask for just be ready to know about your seizure patients. Um, so this practices give you an idea what kind of questions. Of course, your diabetic is a really big population, so expect questions on diabetes. Expect at least one or two questions on your congestive heart failures, etc. Okay. Um, Hemodialysis. The physician plans to increase the frequency of treatment. So just get an idea what they're looking for your hemodialysis patient. So I'll just give you a few minutes to look at the questions, the answer, and the rationale. This is question number 21. Again, I'm asking for this session to just review on with me. You don't have to open the practice test probably afterwards. You can do it on your own. But if we can just do this together, this will be helpful. So that way, and then you can just take notes and look at the answers and the rationales, and then see which questions you want to do flashcards on. Okay. Um, all right. So hemodialysis. Next question, number 22. A patient with a subarachnoid hemorrhage is in moderate vasospasm. The family sees the nurse administering nimodipine to their family member and asks the nurse why she's doing so. Now, this drug, I personally have not used it in a clinical setting. So it's not very common to me, but some people who's reading the question might be familiar with this medication. And then again, I'm also having worked with a lot of subarachnoid hemorrhage patients also. But since it's on this practice test, it might be something that's good to know, kind of like be aware of that. So I would say go ahead and do a flashcard on this one, but again, it's not something I've seen it's not very common. Just be aware. Okay, I'm just gonna go to the next question. What is the most common organism to cause epidermitis infection in the elderly or non-sexually active males? Okay. All right, so I'll give you time to look at the rationale. Okay. So here's the whole entire question again. So I just give you a few minutes. Okay. All right, so we're gonna just go through the next question. Let me know if I'm going too fast or if you want to go back to another question. So again, a patient is in oliguric phase of the acute renal failure. Which physician order should the nurse question? So when you look at this type of question in your reviews, okay, when they say which physician order should the nurse question, also make note of which physician order should the nurse not need to question. So basically in this situation, you can expect for the acute renal failure patient that they possibly can order a K-Exolate, which is A. They can limit oral fluids to 500, so that's okay to do. Okay, so you will not question that. And they can maintain a low sodium, low potassium, high calorie diet. So that's a good way to do a review card. So you're looking at which which one you can question and which one you shouldn't question. So that way you get a more broader view of what acute renal failure is. So this is a good way to review your acute renal failure patient. And that is a question that could be expected on the exam. Okay. Acute. So you want to review your kidneys, your acute renal failure patient. Um, anything that's, again, here's another renal question. And this is pretty straightforward, very common for renal patients post-dialysis. Question number 5. So just know that leg and abdominal cramps with post-dialysis, after removing large volumes, they will get leg and abdominal cramps. Okay, so just take a look and see what's not, what complication is not expected. Again, they say complication, shortness of breath, chest pain, redness of needle, I guess, can happen, but yeah. So some questions you have to read twice, but this one seems like a pretty straightforward question. Okay, moving on to question number 26. Again, another dialysis question. Okay. So even if you haven't seen a lot of dialysis patients, this could be also good review, but I haven't had this encounter. I've worked with certain dialysis patients, but I haven't had to do this procedure where I had to add dextrose. There usually is a dialysis nurse, like say if we had a dialysis patient on the unit, sometimes there's a dialysis nurse that will come to the unit and, help out with these certain situations if there's any problems. Okay, moving to question number 27. This is a good flashcard question. I will do, if I was studying right now for this, I will make a flashcard for these autoimmune types of diseases. So Raynaud's disease, I will make a flashcard. I will also say go ahead and do a flashcard for the other three that were the wrong answers, which is Turner syndrome, Osgood-Schlatter's disease, and Down syndrome. But Raynaud's disease, it says that the nurse noticed that a patient's hands and feet become erythematous when the patient is warm and pale, almost cyanotic when the patient's hands and feet aren't covered. Which of the following is most likely the diagnosis? Raynaud's disease is caused by the body's abnormal response to cold weather and to stress. Okay, so just be familiar with that. And a good, again, another dialysis question. Question number 28. Okay. All right. If nobody have any questions on that one, I'm just going to move on to question number 29. This is a good flashcard question also. All right. So, when placing a Foley catheter in a female patient, a nurse noticed a bluish discoloration of the vaginal mucosa. The patient is known to be pregnant. The name for the bluish discoloration called Chadwick's sign. So, in doing the rationale, they go over why the other answers are not good answers. Okay, so that means that you need to also be aware what a Levine sign is. A Levine sign. So if you know at least one of them, it will help you to eliminate um, the wrong answers. Okay, that will help. So if you know what a Levine sign is or Kerning sign is ahead of time, you'll be like, oh no, that's not what this is. Okay, so that's the way to go about answering some of these type of questions. So it's good to be knowledgeable at least on one or two of the things. So say you didn't know what a Chadwick sign is, and then you're like, okay, you're reading the question and you're like, okay, so but I do know what a Levine sign is. So you can cross that out, and then you try to figure out, make an educated guess on what the right answer is. Okay, so at least from the study question, you'd be kind of familiar. You'd be like, oh, I know, I thought I heard that somewhere, that the Chadwick sign has to do with bluish discoloration of the vaginal mucosa. Question 30. A patient suffers from a significant left middle cerebral artery stroke. The patient is right-handed. Which of the following deficits could the family expect to see in the patient? So maybe at another study session we could just focus on strokes and all other neurological deficits or diagnosis. So stroke, you will for sure, I think, will expect a question on stroke, and this is a classic type of question. You know, so just be knowledgeable that if a patient suffering from left middle, it's usually going to be the right sided that's affected, and vice versa. So just have a general understanding, knowledge of your stroke patient. Um, and I just want to add this test is not as hard as the NCLEX. The NCLEX is, has this level of difficulty. This is just a test that we recommend for nurses who've been in the MedSurg specialty to obtain it for several reasons. It will help, um, it'll set you apart where you will be an expert in the MedSurg. You'll be able to test your knowledge by taking this exam. Um, and you can also be eligible for maybe increase in income in certain hospitals. And now I'm finding out that certain hospitals are requiring that their nurses get certified because of to get promoted to the next level of nursing. So, so it's good all the way around to have the certification. The certification, once you obtain it, is good for 5 years. So like right now, I'm CMSRN, I'm certified med-surg through the board of med-surg. So it's good for 5 years. So I got mine in 2022, and I don't have to renew until 2027. So um, it's a pretty easy process. And again, I'll go through that separately. So you probably want to, if you go the way I did it, you probably want to be a member of the AMSN first so you can get the discount when taking the test. So we can go through that at a different time. Or if you have any questions, you can contact me and I can show you how to take this exam. I mean, the way to apply for the examination. All right, number 31, anticipated management for asymptomatic sinus bradycardia includes what? So asymptomatic means there are no symptoms with the sinus bradycardia, okay? So if you look at the rationale, it goes ahead and tell you if someone had symptoms, what will that be? Symptoms of bradycardia includes pallor, the person be pale, weak, dizzy, altered mental status, fatigue, and shortness of breath. Okay. If the patient become asymptomatic, that's when they'll be including these different drugs. But because the patient is not symptomatic, they're telling us to just monitoring them. So while I'm here, I'm just gonna go ahead and say that on the exam, there are at least maybe one or two questions that they actually show your rhythm, and they either want you to identify it or they'll ask you, okay, this rhythm, what do you, if you see this rhythm, what's your next action? So I think in my exam they had showed me a flat line, and I was able to tell them, we're gonna have to do. I think that one of the options in the answers was to call a rapid. So I was able to choose that. Okay, so here we are, number 32. This type of questioning I did not see on the exam. I didn't see it worded that way. Um, so I don't know. I'm going to just suggest that not to do too much studying of it that way, because basically when I took the exam twice, it just showed me a rhythm. I didn't go into depth, studying in depth on EKGs or anything like that. It just showed me a rhythm, and it asked me, what will you do? Is more straightforward. So if you're med surg, I would just be knowledgeable about that, but I wouldn't do too much in-depth studying in this on at that level. Okay, a type 1 diabetes mellitus patient is admitted with ketoacidosis. The nurse diagnosis that takes type priority for this diabetic is what? So, of course, diabetes is a very common, popular diagnosis in med-surg settings. So, of course, you're going to want to spend a lot of time doing a good, solid review on your diabetes, and also you'll you'll come to recollection all the things you've been learning in the clinical setting as well. So, will just be a good review about the diabetic ketoacidosis. So, this will be a good flashcard. It's like especially looking at the rationale. Okay. So, fluid, these people get dehydrated. So, yeah. Question number 34. A patient diagnosis is adrenal crisis. The electrolyte imbalance that is common with adrenal crisis is what? Low sodium. Right. So that's really good to know. It's not gonna be the potassium, it's not gonna be high sodium, it's not the blood sugar. It is low sodium that causes adrenal crisis. So you might see a question on the exam saying, okay, it might be worded in a different way. They'll be like, the patient is an adrenal crisis. Which labs will you be looking at? And then they'll actually list the different types of labs. So you'll know that you'll be looking at the sodium level. Okay. So this is a really, really excellent rationale, and I will definitely do a flashcard on this one. Okay. So question number 35. A patient develops diabetes insipidus after surgery to remove a pituitary tumor. The critical complication of diabetes insipidus is what? Low potassium. Okay, so critical complication. The most dangerous complication for the patient is hypokalemia, which is low potassium caused by excessive diuresis. Low potassium levels can lead to what? Cardiac arrhythmias such as heart block, ventricular tachycardia, and cardiac arrest. That's why, and then as we're here, just be aware of what a low potassium number is, because they will not tell you on the exam. I'm just going to go through this, and in one study session we're just going to go through all the electrolytes and the numbers that you need to know by heart, just by memory, because they will not provide that to you on the exam. Okay, there will be other questions telling you, okay, the K is 3.6. Is this what do you do? Is this normal or is not abnormal? So you just have to know. Okay, because and if you know it, it will help you, because then you get an easy it'll be an easy answer for you. Okay. Question number 36. Again, this is an easy question. That's if you know your ABG nut values. Okay, so you need to know what's your normal ranges, and they're gonna explain it to you here in the rationale. So I want you to take some time, if you don't know already, on and just make, if you want to make the flashcard right now. I'm just gonna leave this up for a minute so you can see what that is, and then in a different study session we'll go on how to recognize what's acidotic and what's alkalotic and what's metabolic and respiratory. Okay, so you need to make the difference. And these types of questions, when it comes to ABGs, they will not ask you for interventions. They just want you to be able to identify what it is. Okay, is it metabolic alkalosis or acidosis, or is it respiratory acidosis and alkalosis? And it also has to do with where the numbers are. So again, we can start by just doing a flashcard. I'm just going to give you a few minutes to make a flashcard for this one. I'm just going to, so you can know what the normal ranges are. And then at a different study session, we'll kind of go more in depth. So I'll just leave that up for a minute. Okay, so I'm just gonna zoom back. I'm trying to make it bigger. This is as good as it's gonna get. I'm sorry, guys, until I can figure it out. but I have it at 110% zoomed in. So I know the writing might be a little bit small. At some point, I'm going to try to put this in a PowerPoint with larger writing. But let me know if the writing is too small. Okay, so we're going to move on. Okay, we're moving on to the next question, which is question number 37. A patient undergo gastrectomy for treatment of stomach cancer. The complication most likely to develop following gastrectomy is what? So again, today is a good day to do note cards. So that's what we're gonna do. I'm gonna do this same session again, and I will give more time to make the flashcards. Okay. So a patient's going under gastrectomy. The complication most likely is pernicious anemia. So what you want to do is make a flashcard for all the other four answers. Okay. Um, all the folic acid deficiency anemia, um, pancytopenia, and thrombocytopenia. Okay. So I'm just going to give you a few minutes for this one. This is a really good question for the exam. But just know that a patient who undergo gastrectomy for treatment of stomach cancer, complication from this type of surgery is pernicious anemia. And they give you the reason and the rationale. A gastrectomy removes the source of intrinsic factor, the stomach lining, which is needed to absorb vitamin B12. Therefore, pernicious anemia is a risk. Okay? So they give you the exact reason why um, this is being developed is because they are removing the stomach lining, and that stomach lining is putting, once this is removed, is putting you at risk for this type of anemia. Okay. Okay, we're gonna move to the next session, next question. Question number 38. It has to do with Benadryl. Again, read the question and then look at the other answers and see why that those other answers are not the right, they're not the right ones. Okay, so Benadryl, you might know this from personal experience, but in the nurse will educate the patient. A common side effect of Benadryl is sedation.
Recording in progress.
Okay. A patient who develops cerebral edema is given mannitol and Lasix. This one is a good question. So I'm going to give you time to read it and do a question. Do a flashcard. All right. So I'm going to this one is a good, if I didn't say this before, this is a good question for to do a flashcard on. And anything sickle cell, just do a good review on that before you take the exam and what's expected, okay? So for sickle cell diseases, they're asking you to avoid areas of low oxygen concentration. I hope you had a chance to look at why, okay? When caring for a patient with pancreatitis, the first priority is to do what? Administer IV fluids and replace electrolytes. So here again is a good review on acute pancreatitis. And when you're studying, just do a really good review on anything pancreatitis, okay? Because it seems like to be a common diagnosis. So I'll just give you a question time to guys to review that really good.
very unique perspective of the recruitment side of things because I actually live the life of a traveler. God bless y'all for what you guys do every day. I could never spend, I get goosebumps thinking about going to a hospital. So we really appreciate everything that you guys do for our communities. But I do have the opportunity to help and staff travelers all across the country, and it's just been a great experience being able to do that and provide that background and having traveled with Brent. Yeah, just like Brittany said, really excited to share with you guys and be a resource however we can.
I also wanted to point out Nick's mom is also a nurse too. It's not only Mary's one, but he lives like a healthcare professional. I really understand what it means to have a mom as a nurse who can take like this software and do it. And then I also wanted to throw in here, Brian, he was a real friend of mine and just a fantastic resource. I can really vouch for her experience working at Psychiatric. I remember it being just awesome and having to know she has
All right, so we're gonna move to the next. I'm just gonna keep going on. Question 42. I will not spend too much time on this, but just be aware that the living will is for the patient that is incapacitated and is terminally ill. A living will is only appropriate in a situation where the patient is both incapacitated and terminally ill. And then, so you got to distinguish this from the power of attorney who only makes decision with the guidance of an attending physician. Number 43, a nurse is educating a patient with hyperthyroidism when the patient asks what is the most common cause. So again, just be aware of those different endocrinology autoimmune disorders. So yeah, here's one. So I will go ahead. Yeah, and this is a good flashcard question. I'll give you guys time to do some notes on this. Um, I thought they were gonna talk a little bit about the Hashimoto disease and the rationale, but they didn't. Um, okay, but just giving you some time to be familiar with some of the verbal words they use when it comes to Graves' disease and hyperthyroidism. Okay, symptoms that can include tachycardia, unintentional weight loss, tremors, irregular menstrual cycles, and bulging eyes. So this type of question, so it can be worded like this. So you can get a question that's being like, okay, the question reads, you have a patient with these type of symptoms: tachycardia, unintentional weight loss, tremors, and they might give you like, or the patient they give you the patient's heart rate in their 120s, tremors, and bulging eyes. What do you think this is? Okay, so just kind of like when you're studying in that fashion. Which is the following is not a complication of diabetes mellitus? So this is again another good study question. So I'm going to give you guys time to look at the question, the answers, and the rationale. So the way to do a flashcard for this is to say that, okay, anemia is not a complication, but what are the complications of diabetes mellitus? So the other three are complications of diabetes mellitus. So blindness, renal insufficiency, and obesity are all three common complications of diabetes mellitus. Okay, so let's just be aware that again, obesity, renal insufficiency, and blindness are all complications of diabetes. All right. Next question. This question again, I will not spend 100 time. I want to spend too much time doing this. On these type of questions, they might pop up. But so I'm just gonna go through it. We can go. It's talking about stages of nurse-client relationship. Um, but again, if you see that type of question, don't leave it blank. Just make an educated guess. You might get it right. Number 46 is a good flashcard question. When giving Haldol, what do you educate the patient or family of a common side effect of Haldol? This is very good to know. You're giving Haldol, you need to know what the common side effect, okay, and highlighting common. The common side effect of tardive dyskinesia. What is tardive dyskinesia? Is an abnormal involuntary movement of the tongue and or lower face. Okay. All right. I'll give you a minute to look at why the other answers are not it. Okay, I'm going to move on to the next question. So just do a no card. Heart, Haldol, and tardive dyskinesia. Okay, a 40-year-old female with no significant past medical history asked her nurse at what age should she undergo her first colonoscopy. She notes that her uncle died of colon cancer at the age of 82. Which of the following is the most appropriate response? Okay, so this is the current recommendation of when to have your colonoscopy. The current recommendation in the United States is to get screened 10 years prior to the age at which a first degree relative was diagnosed with colon cancer. If no risk factors are present, then it's recommended to obtain a colonoscopy by 45 years of age. Okay, so just be aware of that. These are all prevention. A patient overdosed on a high dose of opioids and was resuscitated with naloxone. What's naloxone? That's another name for Narcan, guys. Right? So no, the naloxone is Narcan. 1 hour later, the patient lapsed into a coma. So what do you guys think happened to this patient? Okay, so they're saying the Narcan wore off before the opioids in the patient's body. So this person probably gonna need well, they're in a coma right now. So 49. Which of the following are least likely to be ordered Plavix? I wanted to just kind of show you guys the question first and then look at the answers. Because I already pre-answered just to save time, but next time I won't pre-answer so that way we can really look at the answers, okay? Because in real life, when you go to the test, it's really sometimes it can be really challenging to try to pick the right answer. Okay, which of the patient are at least likely to be ordered Plavix? A patient with ischemic stroke, a patient, it won't be the patient with ischemic, okay, or least, they say least likely. So from the choices, if someone is bleeding, because Plavix has a okay, let's know exactly what Plavix is used for. So they're saying patients with ischemia so hot and no are commonly given Plavix. But Plavix prevents platelets from sticking together too easily, which help to prevent against clot formation. Okay, so we know what Plavix is for, so you don't want to give them. Okay. Which of the following is not caused by an atropine overdose? Do you guys remember what atropine is for? Okay, so atropine. So this is just a like just to this is something that you just need to know. Like so which of the following are not caused by atropine? So again, when you're reading these type of questions, like during your study period, so what you want to do is write a flashcard and be like, okay, well, this means that atropine overdose, it can cause hallucinations, blurred visions, and diaphoresis. Okay, diaphoresis, blurred vision, hallucination, but it will not cause jaundice. Okay, so common side effects again are, and it is even fever, flushing, ultimate. A common mnemonic for atropine is not as hair, blind as a bad dry bone. Okay, so they have a some type of mnemonic for it. Okay, all right. This question I only was aware of it while I was in nursing school, but other than that, I don't remember. I wouldn't remember something like this. Okay. What is the following is the most common congenital cyanotic heart defect? I just remember this from nursing school, but it's not something I would, tetralogy of Fallot is the most common type. Just kind of be aware of that. I'm going to give you some time to read the other and the rationale what the other ones are about. So that way, if you see them, aortic stenosis may be congenital, but it's acquired later in life. Question 52. Okay, we here again, sickle cell anemia is a common diagnosis that, I think we saw another question before. So again, sickle cell disease is which one is not a common complication in patients who have sickle cell disease? So the other three means that it is a complication. Pulmonary embolism, MI, anemia, those are common complications, but esophageal varices is not. That's how you look at this type of questions. And then when you're doing your flashcard, just write it out that way. Okay, that's what I will recommend. So sickle cell disease is an autosomal recessive disease that causes red blood cells to be abnormally shaped. Okay. All right.
From that one opportunity, she built her network of nurses who have traveled to other places, who've experienced other things, and grew her, diversified her portfolio of just nurses that she was able to connect with and meet. So just be open to those opportunities. Don't just go in tunnel vision. I only want this, this, and this for these places. Like, allow your recruiter to help you find something that would be a good fit that maybe again outside of your comfort zone.
Yeah, like the soft skills. Like we always think about like in healthcare, like what experience you have and like what your specialty is and whatnot. But to Nick's point about Albuquerque, something that I wasn't used to was the Native American population is very large there, and I had never had experience in healthcare with that before. And so learning how to interact with that culture in a professional manner was quite the learning curve. And that's something that you can add to your resume, that helps expand that, not just saying, yeah, I'm a pediatric ICU nurse, but, that patient population and being willing to have an open mind to that. Because like Nick said, never in a million years would we thought we would have gone there, but we absolutely loved it and had a great time.
Absolutely. And then just that last bullet point, very technology. I think the biggest thing that I can stress there is just like the EMR. A lot of nurses will come in like, I only experience Epic and I only want to use Epic. Well, it may limit your opportunity to go to other places that you may want to go down the road, because there are going to be some facilities that they only will accept people with Cerner experience or Meditech experience. So by diversifying your portfolio in that sense and getting uncomfortable with a new EMR, you're going to pick it up. Y'all are nurses, y'all are all healthcare professionals, super educated. You're going to figure it out pretty quickly. And it'll allow you to, again, diversify that portfolio by being able to say, I've got this experience, and I can go to a new hospital now that has that EMR because it's one that I got to utilize when I was a traveler.
Well, I think too about that, Nick, is like, what needs to be charted as a nurse, as a MRI tech, as a rad tech, as a CST. It's really the EMR, learning how, where it goes, so.
All right. I'm moving to the next question. So I'm good. At some point we'll take a break, but we're I don't want to say we're halfway there. We're 30% there. We only question 53 and there's 150 questions. So I want us to get through everything. A male patient confides in a nurse about his sadness and anxiety about being diagnosed with a brain tumor. So this patient is depressed and anxious. He denies hallucination or suicide ideation, which are the following. So again, there is an expectation when you're taking this test that you are familiar with some common medications. So right now, so on this list are common medications that you need to be familiar with. Okay. So of course, the correct answer is Lexapro because Lexapro is for depression, but you also need to be familiar with the other medications because and so to me I feel like this is an easy question because I'm familiar from experience in the clinical setting and in the classroom setting. I know Haldol, what it's for. Keppra, we know it's for seizures. Anybody know what Levoxyl is for? Levoxyl is for your thyroid. So if once you able to eliminate, say you didn't know what Lexapro was, you can by elimination you will be able to choose the right answer. This is a perfect example of how to eliminate, like how to use the power of elimination. Because if you know, you'll be able to eliminate A, B, even if you did not know what C was, but by process of elimination, you will be able to pick the correct answer. Question 54 is more like a ethical type of question. So this is a situation: a patient's sons become hysterical and he start yelling obscenities. What will you do? So just this type of question, you might have to read it twice because it could be kind of like, what will you do in that situation? In this answer, they say call the social worker. But we can go back to that. I don't want to spend too much time on these type of questions, but because you just have to kind of read it maybe once or twice just to get it. Just think about how we as professionals, how we address our patients. So number 55, a patient has been diagnosed with diabetes insipidus. What is the drug of choice of treating this condition? So again, this is a question. It's just you just need to know it. I for example, I don't really give this medication. It's not very common. I haven't really had to give this medication, but so it's just something that you just want to learn and just do a flashcard. So I'm going to give you guys some time because it not only gives you on what a desmopressin is, you also want to know what the diabetes insipidus is caused by. Okay. Um, and what the other medications are for. So just know desmopressin is another name for antidiuretic hormone used in treating those who have diabetes insipidus. So if you can remember that when you take the test, you'll be able to get the answer. This one I'm going to give you guys a little bit of time. This is more like a case scenario question. There's a lot of different components to it. So um this is one question. If you have it, you might want to, like, they're going to give you a cheat sheet, like a blank sheet at the exam. You might want to kind of like read it and highlight it, use the highlight feature to highlight the words so that you can get the correct answer. So basically they're looking for, they want to know if you recognize the symptoms for a diagnosis. Okay, so this one I'm going to give you guys time to read the question and then read the answer. All right. So again, Steven Johnson syndrome is caused by reaction to the penicillin. It's a reaction of the skin and mucous membrane to medication or to medical. It begins with non-specific upper respiratory infection. Okay. So just kind of give yourself time to really, when you're studying, just kind of like, when you went back in school, just take your time and find a quiet place and just go ahead and review it until until it makes sense. So this question number 57, a 25-year-old female is admitted to the hospital for fevers of unknown origin. She has a temperature of 102.3 and is completing a fever, chills, and diaphoresis. She has a known history of IV drug abuse. A nursing student notes that the patient has Janeway lesions. I'm not exactly sure. So we have to know what Janeway lesions is because it's not common. Based on the history and physical exam, it's not pneumonia, it's not meningitis, it's not C. diff. C. diff, they probably will have mentioned diarrhea. The patient has an infective endocarditis caused by her drug use. Endocarditis causes a number of symptoms, but the most classic are fever, chills, and diaphoresis. Common causes are indwelling triple coma. Okay. And let's just go with signs indicating that a present of genuine lesions. These lesions are painless erythematous areas on the palms and soles. So just be familiar with Janeway. Okay. So if you guys are okay, I can move. I'm gonna move on to the next question. Question 58 is a good, also another flashcard question. I'm just gonna give you a time.
There's a lot of like emails and things that go back and forth between your chargers and your managers. When I was on shift, I would just take the form off so that I could, hey, can you fill this out for me real quick? I'd take a picture of it and then I'd send it to my recruiter so that way when I needed updated references, I have that. And then, the longer that you travel, those up-to-date references, you kind of have to follow what's going on to stay like most current. So that was a great way to do that. And then just keeping, the experiences, like what kind of floating you're doing on those assignments, like the date range, because at first I thought, oh, I'll remember.
Which of the following is a treatment for active TB, guys? This is common and something to know. Just you should know. Again, this test is a good review of MedSurg. So I took the test after being in the setting for more than 15 years, and I'm like, why? Why did I wait so long? But it gave me opportunity to do a good review. You know what I mean? So um just to make sure you know your stuff because you've seen it. So and then I was kind of surprised that I had to take the test a second time because I'm like, I think the first time I was just breezing through it. I'm like, oh yeah, I know this. But you do have to take time to look at the questions and yeah.
80% of the jobs that she secured, she just of her networking and building those
This is a
connections.
good question, guys. A nurse is examined who is in a hospital for acute asthma exacerbation. Okay, so they have that cheesy white patches, guys. You guys seen that? What is that? It's an oral thrush. And do you guys remember what they be treating these oral thrush? What will you see in the hospital setting? Can you guys remember which medication they will use for that? The nystatin, swish, and spit, right? So that might be part two to that question. Just be kind of familiar with. So I think this is a good, easy question. I feel like that was a giveaway question. But while you're here, we can go through what a thrush is, different. That's why I like the rationales because they give you more information that you wanna. Okay, so we're just gonna, yeah. Number 61 has to do with asthma exacerbation. Okay, so just get a good review on all your asthma patients. That's very common, of course, in the clinical setting. Just be aware of all the treatments that go with asthma. Okay.
Alert, if you've had experience with a small community hospital. And there was one person in particular that I wasn't too thrilled to work with, and I thought, okay, when I finish
All right, I'm gonna move on to the next question. Which of the following is a complication of paraphimosis? Now, you might be somebody be like, "What in the world is paraphimosis?" You can't remember. So right now we're just gonna do that just do the review because this is not something common. I don't see this a lot in the clinical setting. So we're doing that. That's why we're calling this a study review. A paraphimosis is when the foreskin of the penis cannot be reduced back to its original position. Okay, so they're saying which of the following is a common complication? All right, so we're just reading the answer. So gangrene is a complication of paraphimosis. Moving on to 63. Okay, take your time to read this question in rationale.
Educational opportunities, skill development, stay up to date with technology and trends, strong community of support, plus insider into facilities, locations, agencies, and some of these things that you all have touched on. Boost your resume and reputation. That's a big one. That's really big. And when you're thinking about where your next assignment is going to be, if you can go to a larger hospital, or if you go to like Johns Hopkins or Yale, you're working those types of things are huge resume builders. That's a talking point. That's something that if a nurse manager sees your profile and they see that you've worked at some of those, high ranking facilities across the country, like, oh, this a very skilled nurse. So that's part of kind of building your resume while also networking. Mentor other nurses, precept if you can. Test out if nurse education is a good path for you. Become a resource and share your expertise. Blogs, social groups, fellow travelers. Build your personal brand. I think unintentionally, Brittany and I kind of did this when we were traveling. Brittany had created a Instagram. Really was just to show photos of, like, update our friends and family back in Texas about our going and on when we were traveling. And I think it was a unique story. The fact that again we had our daughter with us, and our page got found by our daughter Izzy. She got to introduce.
Next question. Which of the following is true regarding sickle cell disease? This is a good question. Sickle cell is very common diagnosis in our MedSurg setting. So I'm going to give you guys time to do a note card on this. Hi, Stina.
Hi, this is Annie with Marvel Medical Staffing. How are you doing, Gina?
I'm doing good. I'm on assignment right now.
I see that. I see your assignment was about to end in July. Did you end up extending?
No, what am I doing? No, I didn't extend. Right now I'm in another facility in Boston.
Okay, awesome. When's that contract end?
October, I think it's the 12th.
Okay. Well, I'll go ahead and update my files and state that you're looking for a contract in October. And when I see those start dates, I will update. I'll update you. Yes, ma'am. I'll text you my hello, and so you have my info.
Okay.
Yeah, of course. All right. Have a good day. After all of our years doing that, Nick and I have settled down in Colorado, and she's now the educator at the Children's Hospital out here, and we're able to kind of help others who want to go here or Boston or any of those places, share our information and story so they can kind of get their foot in the door. Because a lot of times in, the professional world, it's not necessarily, it's about who it's not what you can do. I mean, that does come into play, but those personal connections really do help. And then, in my case, I was able to get that job, so.
Recording in progress.
Okay. We're gonna take a 10-minute break in a few minutes, but did you guys get a chance? So sickle cell disease is if whenever you're doing your review, and then uh, at another session I'll show you a book that I've used, like going through all the different diagnosis. So sickle cell is one of them where we just need to do just a good review. So when the questions pop up, we'll be ready. This type of question here, I won't spend too much time. They give you the scenario, and at the end, they ask you how many sentinel events occurred during this hospital stay. I will not spend too many questions time trying to study that. I mean, it could be one of those questions that could take you a little bit of time more than others, but I will. This is one of the type of question you might want to see, like come back to when you're actually taking the exam. But like I said before, just make an educated guess with these type of questions. Did we go over this? They mentioned this medication called Nimotop. I'm not familiar with it, but some of you guys might already be. It seems like they use it for subarachnoid hemorrhaging. The patient is having a blood pressure 50/20. So this is like a case study question. The patient developed a small ischemic stroke. How many sentinel events? I haven't seen these type of questions, but if you want, you can come back. I will, if I was taking a test right now, I will just come back to that type of question. And the questions that I know the answer to will be those questions that I will answer immediately, and just kind of be like, okay, like this question that's come 67 seemed to me like an easy question, like, very like straightforward question. Which of the following is not a symptoms of hypoglycemia? So let's go over right now what are some of the common signs of hypoglycemia. A, it is diaphoresis. B, it is altered mental status. D, it is palpitations. Okay, so those three are common symptoms of hypoglycemia. Okay. What is not is fruity smelly breath, because fruity smell breath is hyperglycemia. So what you can do at this situation when you're doing your flashcards or note cards is to just differentiate between hyperglycemia and hypoglycemia. Fruity smell breath is a sign of ketoacidosis, which also occur in hyperglycemia. We went through some symptoms of hypoglycemia, and at this point, while you're doing your flashcard, go ahead and just write a flashcard on all the other symptoms of hyperglycemia. Okay, hypoglycemia again are altered mental status, nausea, vomiting, diaphoresis, palpitations, polyphagia, tremors, weakness, and in rare cases, seizures. So this give you an understanding of what symptoms of hypoglycemia are look like. Which of the following are signs and symptoms of hypocalcemia, low calcium? Okay, here again is an opportunity for another note card. So you'll do a note card. One flashcard will give you all the symptoms of hypocalcemia, and the other card will give you all the symptoms of hypercalcemia. Okay, so here is the rationale, which is also note card opportunity here. Show text sign is positive when tapping on patient's zygoma, including facial twisting. It is a common seen in people who have low calcium, hypocalcemia. A common mnemonic to remember symptoms of hypercalcemia includes, okay, so they have some mnemonic for that. Hypercalcemia can cause stones to form in the renal biliary tract, bony pain. So so again, now you can remember Shotek's sign, which is a common sign of hypocalcemia. Here is a question on pancreatitis. Let's see if we can. A 68-year-old male with the history of alcoholism has developed sudden onset of epigastric pain radiating to the back after eating. The pain is exacerbated when the patient lies flat or walks. So let's look at all the symptoms here. They having pain after eating. Pain is exacerbating when they lie flat or walk. The patient is pale, tachycardic, and has nausea and vomiting, a temperature of 39. So they're febrile right now. Physical exam shows her abdomen is tender but not rigid, is without guarding. The most likely cause of this symptom is what? Pancreatitis. So this is a good opportunity now to go ahead and do a flashcard on pancreatitis. Um, and so now you know all the symptoms: nausea, vomiting, maybe fever. If they lie flat or walk, the symptoms are there. It's severe epigastric pain radiating to the back. Okay, so here's the symptoms: abdominal distension, jaundice may occur in some patients. It can be febrile, tachycardic, pale, serum amylase and serum lipase may be elevated up to 3 times normal. So that's something to know, that patient with pancreatitis, how are you recognizing what are the labs to look for elevated amylase and elevated lipase are high, and they can also present with leukocytosis, may be evident. We're going to go to the next question. A patient has a permanent pacemaker. To me, this is seem like an easy question. Question 70. Which of the following is usually contraindicated with patient with pacemakers are MRIs? So you'll see that a lot in the clinical setting, which is a good way to remember this. MRIs are generally contraindicated with people with pacemakers, because you guys remember when you do the questionnaire, like the screening for patients who are going to MRI, they often ask them if they have a pacemaker. They need to identify like which type. It's a whole screening process. MRI's scan works by using magnets. These magnets can cause pacemaker dysfunction and may actually pull the pacemaker out of patient's chest, causing him. It's like a whole thing. Currently, some pacemakers are being created that are MRI compatible. So you'll do the questionnaire and they'll ask, you'll see in the questionnaire, like they want to know what type of pacemaker it is, like which, yeah. However, unless the patient carries a card that verifies that their pacemaker is MRI compatible, MRI should be avoided with that type of patient. Okay, here's an EKG question. The medical team ordered an EKG for a patient experiencing chest pain. The nurse attempts to apply the electrodes. What's the good thing to do in this situation? Patient's hairy won't stick. They'll tell you to shave the patient. Okay. Um, in 72, a nurse is trying to consent for an elderly patient's hearing impaired. Do not act out the surgical procedure. They say which one is the most inappropriate. So this is to highlight so you don't get it wrong. They just giving you options. So just kind of get the concept here. Because you might find a question like that, but it might be worded differently. They're just saying what's an inappropriate way to communicate with the patient. Which of the following is not a treatment for diabetic ketoacidosis? So again, here's a educational opportunity. So the way to look at this question is what are common treatments for diabetic ketoacidosis? So know that they might treat it with lances, A, B, IV fluids, or C, IV potassium chloride, but it will never be D50. It's not common for D50, dextrose 50, to treat diabetic ketoacidosis. Okay, so I'm going to give you a minute to look at the rationale on the administration of D50 is used for patients who have that hypoglycemia, right? But D50 will only worsen hyperglycemia, which is what's going on here. So this is a good review. And as you guys know, diabetes is a very popular, very common diagnosis in our MedSurg areas. They said hypokalemia is also often present with DKA. Therefore, it's recommended to administer IV potassium if potassium levels are high. So just we can go through this again when we do our more in-depth review. But I'm just gonna skip to the next question, which I think is another straightforward question. I mean, I feel like this is just to know. You might not even need to do a flashcard if you already know. While being interviewed, a patient tells her nurse that she develops anaphylaxis when exposed to IV contrast and seafood. Which of the following is contraindicated in this patient? Okay, so you guys know that if you have allergies to and you have exposed to IV contrast seafood, they said CT angiogram will be contraindicated. In cases of allergy to IV diet, patient may be prepped beforehand. The prep includes steroids and Benadryl. So if they have to do a contrast, so the contrast has seafood. Yeah, they will have to probably give this patient some type of like steroids or something or Benadryl so that they don't have a reaction. Um, in case they have allergies to IV dye before getting the CT angiogram. Okay. So this question is just kind of like a nurse is caring for a 61 with a known family history of hyperlipidemia. She has had diabetes and high blood pressure that are controlled medication. Which of the following is not a risk factor for coronary artery disease in this patient? This might be just a good to know type of question. Like you just have to make an educated guess again if you do present with this type of question. Just read it and try to let me see. She has diabetes, high blood pressure that are controlled with medication, which the following is not a risk factor. They saying sex is not a risk factor. So risk factors for coronary artery disease is what you want to know. They saying that females have a lower risk for cardiac artery disease. Other risk factors include high cholesterol, stress level, weight, and activity. Okay. This one is a case study question, so I'm going to give you guys time to just really look at it and look at the rationale if you can. Just going to give you a few minutes while you're doing that. I'm going to go ahead and step away for a minute. So I'm going to give it maybe like 10 minutes to look at the question because this is a case scenario and they want to know which of the following should be the initial step in stabilizing this patient. It's the answer saying intubate, but because they're 76% on a non-rebreather, but take a minute to really look at the rationale is why they're telling you to intubate. Okay. Why are we intubating? The respiration is 38, oxygen is 76% on a non-rebreather. Okay. The next question is, all right, I said I was going to give you guys 10 minutes. Okay. Stabilizing the patient airway is the most crucial first step in stabilizing the patient. Her oxygenation is only 76% on a non-rebreather, and a stridor is reflective of swelling in the airway. The patient is not receiving sufficient oxygen and will go into cardiac arrest and develop neurological compromise if this is not reversed. Anaphylaxis is defined as a serious allergic reaction. that cause rapid appearance of sinus symptoms, which may ultimately result in death. Okay. All right. So, all right. This might be, we can go over this again when we go through the more in depth review. Okay. Which of the following is not a sign of anaphylaxis? Which is like anaphylaxis is when people have like a allergic reaction. So angioedema is a symptom of a reaction, allergic reaction. Cardiac arrest and respiratory distress is one, but not usually urinary and bowel retention. Okay, it doesn't occur when you have an anaphylaxis or allergy reaction. Bowel or bladder incontinence is usually associated, but angioedema is like when you have the tongue swelling or facial swelling is usually happens, which is usually not life threatening and be treated with steroids. Question 78. I'm going to give you a minute to this one. Just be familiar with what the drug oxytocin. I didn't see it when I took the exam, but I remember the medication oxytocin from the times when I was in nursing school. So just something that's good to know. Okay, oxytocin is for most strengthened uterine contractions. Okay, this one again is a straightforward question. Patient diagnosed with C. diff. We know C. diff. What do we treat C. diff with? Vancomycin. This is very common. So, again, this is a straightforward question. Hello?
Hello, Gina.
Yeah, this is Gina.
Hi, Gina. This is Michael calling from Tomo Finance. I wanted to reach out to discuss a personal loan offer we sent you in the mail. Have you had a chance to review it?
Is there a website? I don't think I've seen the.
No, it's for your regular mail.
Yeah, I don't remember seeing it.
Okay, no worries. Do you have a couple of minutes?
No, not really.
You're busy right now?
Yeah, but
Oh,
I had to run.
when will be a good time for me to call you back?
Oh goodness, I'm thinking maybe tomorrow morning, maybe.
Tomorrow morning, like around 10?
Yeah, that's fine.
Okay, I'll give you a call back. My name is Michael, okay?
Okay, thank you.
All right, have a good day. Bye-bye.
All right, I'm sorry if I know there's some sound in the background. I'm sorry about this. Again, C. diff is a common vancomycin is what is used to treat vancomycin. Okay, so just be aware of that. Okay. 80. This disease I'm not familiar with, so this is kind of like it's not I haven't seen this in common practice, but it's probably something you want to do a note card just to know. A woman in the hospital have heavy menses, prolonged bleeding time, and chronic anemia. This patient should be screened for the disease. It's a von Willebrand disease, so just be familiar. So giving a minute to look at that one and the other diseases, what Parkinson disease is about and what Turner syndrome diseases. So this will be a good opportunity to do the note cards on the other diagnosis as well. All right, so I'm gonna give you guys a few minutes and a little break. I'm gonna try to come back in about 10 minutes while you guys do a note card on this question.
watch the presentation if you need to. Second, I have enabled the question and answer feature in the chat box. So if you use the question and answer feature in the chat box, you can put a nice blue box around your question so that I can see it's a question. Feel free to ask questions during the presentation, and I will stop at different points and answer some of the questions in the chat. We have over 130 class members so far, so I know I will not be able to answer all of the questions, but I will stop and take a few at each point along the way. I want to make sure we also get through all the information that we need to. Finally, folks, I've enabled the transcription. So if you're using a laptop or a computer, you'll be able to see the subtitles of what I'm saying. If you don't see them on a laptop or computer, check the settings on the platform here to see if they're enabled on your end. If you are joining from a phone, the subtitles are not accessible using a phone to join these classes. By the way, if you are seeing the subtitles on your screen, they're blocking any information on your slide. You can actually click them and drag them to a different part of the screen so that it doesn't block information on the slide in front of you. So please note that as well. Okay, that is all my technical notes for today, folks. Let's jump into the first section of today's presentation. This is going to come probably as no surprise to anybody here, but this is something that we see consistently in research over and over again. The research shows when we talk about building routines in our day-to-day life, the routines happen to have higher levels of motivation associated with them. So what we see in research is that people that stick to a particular routine tend to feel more motivated, or at least report feeling more motivated in their day-to-day life. Now, here's what I want to say about that, folks. What we need from a routine can be flexible and can differ depending on who you are and what your life looks like. So I think when people are routines, as I said, I'm going to give you kind of a different perspective on this. When I think people hear routines, I think they think about doing the same things over and over and over again every day. Now, I don't know if that is necessarily the most effective approach to building routines into our lives. I don't think that you necessarily have to do something every single day in order for it to be technically consistent. I think that consistent means is that in general, you are implementing certain tools to help boost your motivation. So when we talk about routines and motivation today, please, and I'm not necessarily saying that some of these things are needing to do every single day in order for them to be effective, nor do I always think that the most effective approach to building motivation in your life is to do the same thing each and every day anyway, because I think sometimes that can get quite boring. I think that we can lose motivation after a while when it comes to that. So I think we as human beings have the ability to adapt and be flexible. And so we don't want to suddenly no longer be able to be flexible and adapt because we're so overly stressed about keeping the exact same structure every single day. The tools that we go over in the presentation today are more focused on things that can be a consistent basis, but not necessarily something you have to do every single day and still get the benefit from it. And what are those tools, as we mentioned earlier today in the class, folks, as we're getting into it? We're going to talk about light, body temperature, and exercise, resting the body, as well as caffeine intake. And I'll just say a few notes in general, actually, about being aware of what we are consuming in our body and how that affects us also. So I will cover that at the end. As I did mention, even if you don't have the same exact schedule every day, I think a lot of these tools are going to be helpful for you. So let's get into our first tool of the day, using light to maximize routines and motivation. I'm going to talk about how to use natural light or sunlight to maximize routines and motivation. I'm also going to talk about how to use artificial light as well. So if you don't wake up when the sun is coming up, if you wake up before that, or you work on some kind of different schedule where you're not up in the mornings, we will cover artificial light and how it can be beneficial to routines and motivation. We'll talk about natural light as well. So first off, let's jump into this first section here. higher levels of energy and motivation in the beginning part of the day. So that is something that we see over and over again, and it kind of makes sense evolutionarily speaking. Right before we used our phones and our alarm clocks to wake up, right, we were sort of geared toward the schedule based on when light was out in the rest of the day. So if we sneak in early morning light, it tends to show that most of this have a greater reported level of energy in the beginning part of their day. Now, if it is a nice, bright, clear, sunny day, we all hope for every day, right? If it's a bright, clear, sunny day, actually only need about 5 minutes.
Okay, everyone, I'm back. For time's sake, I'm just gonna start going through the questions very quickly because I'm gonna see if we can finish a little bit before 4 o'clock, and then I'll announce when just pay for future references when the next session is. I'll try to announce it ahead of time, and I'm also gonna try to make it more. Probably it's gonna be a weekend day or an evening so that more people can come out. So we'll probably do the next time. We'll do more in depth so that people can have time to look and then ask questions. Okay. All right. A patient has 24-hour post-op with pulmonary lobectomy, requests pain medication for severe pain. When the nurse brings the opioid medication, the nurse finds the patient laughing and talking to family. What should the nurse and patient do? Here it's asking you to use a little bit of judgment. And in the medical surge, in the acute setting, pain is a very big thing. And the point of this is that you really, like, some people, like, the patient is the one who is in control, because you can see a patient laughing and they're still in pain. So they say, if you look at the rationale, patient may try to not show pain. So pain is the patient is the one who's in control of their pain. Like, whatever the pain, it's not a subjective thing. It's like whatever the patient says that they have, we have to take them at their word. Okay. So like they said here, one of the barriers to adequate pain management is a nurse's preconception about physiological and emotional response. So we have to take them at their word that what they say they're in pain, that their pain is a 7, even though they look like they're laughing. We just have to take them for that. All right, here's another question, 82. A 50-year-old bedridden patient has unilateral pain, swelling, and lower extremities. So here is a question on deep vein thrombus. So just know the classical signs of a deep vein thrombus. This is very common, and also know the treatments for it. And what tests. So we already know from previous questions that the test that they use for deep vein thrombus is the Doppler. So just be aware of that and just know the kind of treatments they use for that. Okay, so this again is a good flashcard opportunity. Just know, and then for me, I think that this is a pretty straightforward question. Positive Holman sign, no significant passage of the leg is not erythemus or cyanotic. Which one would be list of differential diagnosis? So pain swelling is the most likely diagnosis. Would present with calf pain and swelling, and approximately 30% of the patient will have positive Holman sign, Pain is elicited, homicide. Okay. So then you can also, while we're here, just do a quick review of compartment syndrome and the other diagnosis. Okay. So here you have an idea what deep vein thrombus looks like. All right. Next question has to do with which of the following is not a risk the factor for developing listeriosis? Listeriosis is spread throughout contaminated food, milk, soil, and water. So the other question answers are raw vegetables, hot dogs, and unpasteurized milk are all risk factors for listeriosis. Um, all right. So okay. So this one, just be familiar. Um, all right. So now we know what listeriosis is. So you're gonna find it for with vegetables, hot dogs, unpasteurized milk. Okay. Next thing we're gonna cover is chest tubes. A patient who's restless pulls out the chest tube when trying to get out of bed independently. Which of the following by the nurse is most immediately indicated? They say it's a covered insertion site with a clean glove hand. This is immediately. Okay. So you just want to keep it secured until they get another chest tube. Um, all right. So just that's another thing to put on the list. Be familiar with chest tubes and surgeons, like what are the emergency equipment when it comes to chest tubes, how to maintain it, etc. A patient with this is a case study question 85. A patient with history of heart failure and supraventricular dyspnea has been maintained on this oxygen, has been developing bradycardia, headache, fatigue, nausea, diarrhea, and green halo vision. The physician has ordered serum digoxin, electrolyte levels, and continuous EKG monitoring. Which of the following electrolyte values will be the most concerning? In any situation, a low potassium is always concerning, and we know why, because it can increase the risk of digoxin toxicity. So I'm just going to give you a minute to look at the question, the answer, and why hypokalemia is so dangerous. I'm giving you a minute to review the rationale if you want to write some notes. All right, we're gonna just go through. I would like for us to get through all 150 today because we just at 86. That means we have about 70. Okay. A patient has been diagnosed with Parkinson's disease. The patient's family member asked the patient nurse what causes Parkinson's disease, and this is it. And this is the way I remember this answer is because I memorized in my head this substania nigra, which is causes cognitive and motor deficits. Okay, so let's just review Parkinson's disease. If you guys want to just write some notes on that. Parkinson's disease destroys dopamine producing neurons, is the substantia nigra, and causes motor symptoms, tremors, as well as cognitive symptoms. Approximately 80% of the substantia nigra is destroyed prior. There is no cure, but medication can be prescribed to alleviate. So just review your Parkinson's disease. A patient has been diagnosed with Addison's disease. The patient's family asks what causes Addison's disease. So it's kind of the same. So now we review Parkinson's. We're going to go ahead and review Addison. And Addison has to do with the lack of cortisol. Giving cortisol helps alleviate the disease. Common symptoms include hypotension and hyperpigmentation. It is caused lack of an adrenal gland. Okay. Okay, so give you a minute to read this. So again, next time we do this study, we're just gonna we'll just answer the question together, so that way we can go through the process of how to answer, how to look for clues and how to answer these questions. Okay, so this question has something to do with more like communication and what's appropriate and what's not appropriate in the clinical setting. So this question basically is saying that this patient, a family member, somebody called to get some answers about this patient, and they saying what is appropriate response. Okay, they want to know some information about this patient, but they don't. The person family member wasn't consented, so they said you can give consent over. Okay, hold on, this one. Oh, okay. I'm sorry. I'm going to go back. This question has to do with consent for surgery over the phone. And yes, you can give consent over surgery over the phone, but there will have to be a second nurse to witness. That's what this one is about. You'll be able to do. So those questions are not common, but we can go over this again when we're in depth. Okay, so number 89, I'm just going to give you a minute to review this question on your own. Okay.
Let's see. Cool. I'm running the other way.
He really. All right. So the patient most likely has benign protat, which become more common in men at this age. A Coude catecat is a slim, specifically designed to those. So Coude. So that might be something to just remember that a Coude catheter is designed for those people with BPH. Okay. So this one, I just want you guys to. I wish I didn't answer this one, so that way you guys can figure it out. So an NG tube is halfway out. The patient needs an NG tube to receive tube feedings and medications. Several of these medications are due now. What is the most common appropriate action to be taken by the nurse? And they saying that you're going to pull the NG tube out, reinsert another, and obtain an X-ray. I'm just going to move through because we, yeah. This one, a patient who often have kidney stones asks his nurse what he can do to prevent reoccurrence. All the following are appropriate except what? Okay, so a patient who has current kidney stones can decrease their protein intake, they can decrease their sodium intake, they can increase their fluid intake, but they do not need to increase calcium intake. Now, guys, I want you guys to see why. Patients should limit their calcium dairy intake since most stones are composed of calcium oxalate. And go ahead and read the rest and see if you can make any notes from that these answers. Okay. All right. Okay, so you don't want to. Okay. Moving on to which of the following is inappropriate for non-infected stage 2 decubitus ulcers? All right. I'm going to give you a minute while you're reading it. Look at it will help you to differentiate between the stages in pressure ulcers, the stage 1, 2, 3, and 4. So I'll just give you about a couple of minutes. I'll be back. All right. So, all right, surgical debridement is generally not treated modality for stage 2 decubitus ulcers. Okay, I'm moving to the next Which of the following medication is inappropriate treatment for Meniere's disease? So at this time, you need to know what Meniere's disease is, and also know that the appropriate treatments for Meniere's disease are introvert, Zofran, and Lasix. Okay, so they say Meniere's diseases are caused by dysfunction of the inner ear, causing episodes of vertigo, motion sickness medications, and antiemetic medications, so that introvert and Zofran may provide symptomatic relief of vertigo symptoms. So, as we took our little break, I came up with a time for our next session this week. Ruja, can you hear me? Can you unmute? Oh my, can you unmute
So
me?
it
Oh,
was
how
so
are you? Oh my god, how are you? How long were you on the Zoom? How long were you on the Zoom for? Hello? Okay. Um, I think I lost him. Oh, okay. I was so excited. I think we had one person on the Zoom and I lost. Okay, I lost someone on the Zoom. Ruja, include them on the chat here or on the Zoom. Stay. Okay. Okay. All right. So I think I lost some people. Oh my gosh, I was so happy. I had another person on the Zoom, but I think I lost him. So if he comes back, I don't know if I said his name right. Ruja. Okay. So we're gonna just keep moving quickly. Okay, so the question you guys see is the Haldol. So now we know what Meniere's disease is. All right, so we're gonna move to the next question. A 55-year-old patient with known history of tobacco and hypertension has not seen a doctor in over 10 years. He states that he feels fine. Secondary prevention will include what? Colonoscopy. So there's a list of primary prevention and secondary and tertiary preventions. So that's what this question is really about. They want to know if you have an idea what. So colonoscopy is a secondary prevention. So if we read the rationale, we get a better idea of what we're talking about. So colonoscopy. So we know what a colonoscopy is, right? So what are primary prevention? Is to help prevent the pathology before it exists. Vaccinations are primary preventions. Tertiary preventions is aimed to help alleviate pain and prevent secondary complications from a pathology infection. Obtaining radiation and chemotherapy in a patient with lung cancer is that type of an example. So that's what this question is really about. So know that secondary preventions are colonoscopy. First, primary preventions are things like your vaccines and things like that. So this question has something to do more with nurse. What will you do if you had a patient with this incision and they started bleeding? Which of the following should be addressed first? So this patient is having several problems. They're in pain, and they having bleeding from the incision. So and they're having nausea apparently. So this is one of those things. Is like they just want to see if you're able to prioritize care here. Like, is it the pain you're gonna take care of first, the nausea, or what? And in this case, they're telling you that it's the incision that you need to take care of. All right. So, all All right, the next question is which of the following is not a Joint Commission National Patient Safety Goal? Okay, so we aware of Joint Commission. To be honest, I took the question twice. I don't remember seeing any question about Joint Commission, but I feel like, okay, it might be good to know. You never know. It might pop up. But just to know, because, uh, so Commission safety goals. So we're gonna go with the one that are what they're looking for. They do want us to identify patients that are high risk for suicide. That's a safety goal. They do want us to follow CDC hand cleaning guidelines. They do want us to relay important test labs to the correct person in a timely manner. But let's see. So by elimination, we'll be able to answer the correct one. And the correct one is like, which one is not a patient safety? They say at least one form of identification. The truth is that you need two forms of identification, which is the date of birth and the patient's full name. Okay, so this one should be a really direct and easy one. So I'm not gonna stay on that too long. So this 97 is more like a case studies question. So I'm gonna give you a few minutes to look at the question, read it completely, and see why. Okay, so basically this question wants to see if you're able to prioritize. Okay, if you're able to prioritize the patient. Okay, are you able to prioritize your patients? And again, I'm looking at the screen. I wish I could make the questions bigger. I need to figure out how I'm gonna do this. So basically on your screen, you'll have to like um enlarge it because I for some reason I'm trying to enlarge it, but it's like it's not working. There gotta be a way I can get rid of the grid on the left, which is the green grid, and try to open it up, but we'll see if I can figure that out. Um, no. So if anybody who's tech savvy can help me, okay. I don't know if this is okay. So a nurse caring for a patient. So they giving you a list of 4 patients that you have. Like say you're started your shift. You got 4 patients. Which patient you want to see first and last? So they asking you here which patient should you see last, and they telling you the patient with the post appendectomy. Okay, most likely you probably need to see the patient with um I'm gonna get subdural hematoma first and then the chest pain. So, but for sure, the post appendectomy is not a priority at this time. And they do say in the rationale the patient with subdural hematoma should be first, and then probably second would be the chest pain. All right. So that's what that question is about. Prioritizing your patient. A nurse receives a phone call from the lab stating that a patient's serum potassium is 6.5, but it is hemolyzed. Which of the following is the most appropriate step in intervention? Um, it'll be to send a repeat potassium. Okay, because it's hemolyzed. So that's the clue. It's hemolyzed. If they didn't say it was hemolyzed, then that would be a whole different question, a different answer. But because they're saying it is hemolyzed, that's the clue. Then you need to we need to repeat. So that's the clue right there. Okay. A nurse accidentally splashes himself in the eye with chemical solution. All of the following are appropriate except what? So let's go with what's appropriate. You need to go to employee health and report that incident. You need to call your nurse manager. You need to get your eyes with water flushes. But what you're not going to do is place an eye patch over the affected eye and continues to work. So this is one of those questions. It's like you just have to think about how, what seems to make like the most sense at this point. Like that just doesn't seem like that C question. That just doesn't seem like that's a safe thing. Safety, that doesn't seem like a safe thing. That's for yourself. Like, because right now at this point you're injured, okay, on the job. So you do need to go report it and go to employee health and do more action than just cover your eyes, because you might lose your eyes if you don't do it. 100. A nurse caring for a patient with chest tube. Notice continuous bubbling in the water sealed chamber. The nurse has determined that the leak is inside of the chest. Which of the following? So you see the continuous bubbling, which is signaling that there's a leak, right? So what do you do? So right now we're just gonna take the time and do some good chest tube education, and maybe in another session we can actually look at a video on chest tube. That's a good thing if you really want to get more in depth in your review and you don't remember. Good, it might be a good time to go look at a when you're studying, look at a YouTube video on chest tubes and leaks and how to maintain, and that might help you remember. So the chest tube should be placed on suction until the air leak resolves. Okay, so let's just go over that. The place the chest tube on suction until the air leak. So you noticing the air. So I'm going to give you a chance to read the rationale and take notes if you have to. If the air leak is coming from inside of the chest, it means that the lung airway is not sealed. It is most difficult for the lung to reinflate if there's an air leak. So because they want everything to be sealed, the tubing should never be clamped indefinitely. Okay, so there's a few things I just want you to take time to read. And I think we might, for this session, we might have to finish a little early, and we might not get to all of the questions because we do need to finish closer to 4, and we only at question 100. So instead of a 2-hour class set study, this is more like 3 hours, maybe more. Because you really, when you're studying, it's just like when you're studying, you really cannot rush through these questions. You really need to take your time in it because it's a study session. You have to stop, take notes, read the rationales over and over until it kind of like you can kind of memorize it a little bit. I'm not going to stay on question 101 too long. This has something to do with sharing information. This patient's husband is calling, wants to know information, and they were like, the answer is you can't do that. The appropriate response is you can take the person's name and even if it's the husband, and they can provide the so this has to do with HIPAA. Okay, so just kind of get I'm almost sure there's going to be a HIPAA question on this test because it's so common right now. Which of the following will not help? The key word to highlight here is not help alleviate headache, status post lumbar puncture. So what will help is Tylenol. What will help is epidural blood patch. C. What will help is rest, but what will not help is reversing. You know how when you tilt the patient a little bit upside down, and they say no, that's not going to help your headache, because that can actually cause more damage. So here's a good time to review what epidural blood patches and they use to treat CSF leak and why the Trendelenburg is not going to help with that. Okay, I'll just give you a few questions, a few minutes. All right. Okay, so you guys, it seems like we're gonna have to end at 4, and I'll try to get another session going. But I believe at 4 o'clock we're gonna have to wrap it up. And I didn't realize this. I thought I was just can go through the questions really quickly, but this is more like a 3-hour. It's if you're really serious about going through all the questions. So, all right. And I don't think I can go through 40 questions in 15 minutes. Question 103. This patient's in hypertensive crisis. They saying they're having a hard time being compliant with their medications. So this is a teaching education moment. This is what, so when you're answering these type of questions and they want to know, like, if you know what type of language or what type of how, like, in terms of communicating with your patients. Okay, so the clue is in the answers. So think about how we speak to our patients and the professional language we need to use. and what's appropriate. You will, so just look at this one. It's not that, so you will never tell a patient that, oh, it's not hard to remember to take medications. That's just not an appropriate way to speak to our patients. B, if you don't take medication, you will die from renal. Like this one is a little bit too, you don't want to cause fear in your patients. That's just really not the really right way to educate our patients. C said, while it may be difficult to remember all of them, even if you take one or two medication, it will help your blood pressure. That's not really accurate either. So the most accurate way to answer this type of situation is kind of like, if you look at the way the answers, is a little bit of empathy going on here. Kind of like it's like you want to empathize or sympathize a little bit. And this is more like the approach and the language you want to use when you're addressing these patients. So just something to think about is like, how do we professionally communicate with our patients? Okay. With chronic kidney disease, potassium sparing diuretics are recommended for what? Potassium is with persistent hypokalemia. And I guess the clue is in the question. Chronic kidney potassium sparing diuretics puts, hypokalemia. It's not gonna, all patients, okay, so I'm gonna give you a minute to read what, and the rationale is what a potassium sparing diuretic is for and what it's able to do. It could be a little confusing, but just kind of know, because there's different types of diuretics, and this might be a good time to review all the different types of diuretics that you have. Okay. All right, so we're gonna move on, and then, like I said, we're gonna end a little bit earlier. Which of the following is reflect a tertiary intervention? We went through that with one of our other questions. Um, this is third intervention after the fact. So this is, in this case, is including a diverting colostomy stage 1. Ordering a mammogram, I believe this might be a primary intervention. Educating a patient about the importance of physical activity. Okay, they saying here perform a mammogram is example of secondary prevention. The vaccination is like D is primary. Okay. All right. And then they saying this surgery is third. Okay. So we're gonna go over that. So question 106, a patient is treated for an acute alcohol intoxication. The patient family asks why they doing the banana bag. So you guys know the banana bag is the one they have with all the different vitamins, folic acid and all that for, treating hangover. Which of the following is not a correct response? So the keyword here is not. So which one will be a correct response is, well, yes, B, it helps to rehydrate the patient. C, it helps to correct electrolyte abnormalities. And D, yes, it provides the patient with vitamins that may be deficient in after drinking alcohol. So these are appropriate ways that we communicate, and this is accurate. But what you will not tell the families that it prevents the occurrence of a hangover, because it doesn't. It's not going to prevent them from getting a hangover. They could still get withdrawals and all that, even after they give them that. Okay, 107. A patient is given Synthroid. We what is Synthroid for? And this one I feel like is pretty direct. if you look at the answers, Synthroid has to do with hypothyroid, nothing else. Okay. So they ask you what the medication is given for. So A is eliminated, B is eliminated, D is eliminated. So C has to be the only answer. So this is a time for you to review what Synthroid and what is hypothyroid about. So I'll give you a few minutes to look at the rationale. It says that signs and symptoms of hypothyroid may include bradycardia, dry skin, hair loss, unintentional weight gain due to slow metabolism, short stature, and neurological abnormalities. So this is a good time to just go ahead and review what Synthroid is for and what are the signs and symptoms of hypothyroid. Okay. 108, a 72-year-old had a total knee replacement. So this has to do with the medication you give when a patient is confused, disoriented, visual hallucination. So this is more medication. So all these medications that are here are medications that you need to somewhat be familiar with and what they're used for. Okay. All right. So like I said, we're about to wrap up. And then Tuesday we have to do, the next time we come around, it has to be 3 hours. 2 hours is just not enough. Um, okay, so it's just not going to be enough. Okay, we're moving to the next question. The question is, a patient with stress incontinence has her ask her nurse, is it anything to help alleviate symptoms? Which of the following again is not an appropriate suggestion? So let's talk about what are the appropriate suggestions. You want to take frequent bathroom breaks. You want to practice Kegel exercises. This is a good time to review what Kegel exercises are about. And you do want to avoid and or limit alcohol, okay, to help with stress incontinence. Okay, so but what you're not going to do is increase caffeine intake because, as you guys know, increased caffeine does act as a diuretic. I know we used to hear that a lot, but it's actually um, a fact that caffeine does act as a diuretic, and which will make patients to have to go to the bathroom more often and will not exacerbate their condition. All right, 110. This is just again, this has to do with appropriate um communication and what's actually what happens upon discharges and what to tell, what you communicate with family. So there's a patient that had a stroke that has a problem toileting and dressing himself. He's just scheduled to discharge in 2 days. Which of the following? Again, they use the word not. Just pay attention to these words that you do not tell, which is not an appropriate action to not take. You do not tell the patient that he has to go to a nursing home. But you can talk to the social worker about setting a home health aide, educate the patient's wife on how to assist her husband at home, or talk to the medical team about the possible needs for rehab. This patient doesn't necessarily have to go to a nursing home. And they say here in the rationale, a patient should never be told he has to go to a home or a rehab or to a long-term facility. They can suggest it, but you don't have to be like, well, you have that. This is a requirement. I guess just pay attention to the language. Again, it's the same scenario in question 111, and we're just going to end it here to just give you some time to look at the question. This again has to do with what's appropriate and what's not appropriate to tell our patients. So we did good. We got through at least 111 questions. There's about 40 questions remaining. If you want, you can do practice on your own. Let me see if I can put it on here. Mometrics.com. Okay, so it's gonna be mometrics.com/. Okay, mometrics.com / academy / MedSurg. Mometrics.com / academy. Okay, I gotta write this down for you guys. Okay, mometrics.com / academy / MedSurg, comma, let me see. So mometrics.com / academy / MedSurg / practice / test. Okay, you guys got it? Wait. Okay, mometrics.com / academy / MedSurg - practice / test. All right. So that's it for today. So again, we went through 111 questions. This is what the test is like. It's under Mometrics nurse exam practice test. I got it with 93%. So it's a free test. When you get to question 5, it's gonna ask you to put in your email, but it's still a free test. And if you want, you can go ahead and buy some of the Mometrics tool, their study guides and everything. That's up to you. But again, this is the end of our session. I'm gonna do it again on Tuesday. See you guys Tuesday, and you guys have the rest of your Monday. Okay, so we'll do it again. Please contact me. Let me know what time works for you guys. Evening, because I'm guessing evening in a weekend. It's gonna be like a Sunday afternoon or something. But we can no longer do this for 2 hours. It looked like this is more like a 3-hour situation to get through all the questions. Okay, because I started at about 1. I wanted just to do 2 hours, and I still have 40 more questions to go. But you guys can go ahead and practice on your own. But I'm gonna come back on Tuesday, so it's probably gonna be like more 2 to 5. And when you come with your questions, and we can just like get through it together. Okay. All right.